Good afternoon and welcome to today's 20-minute webinar. Today we're going to explore What Works for Health, an online resource that provides information to help select and implement evidence-informed strategies, including policies, programs, systems, and environmental changes that can really help to improve health behaviors, clinical care, the physical environment, and social and economic factors that affect health. This tool is especially helpful when deciding how to address your local priorities. My name is Kate Kunkel, and I'm the Action Center Director for Research and Learning. I'm actually filling in today for my wonderful colleague, Allison Burgum, who leads our evidence team. She was unable to join us today, but she did put together the information that we're going to share. So this really does come directly from our team that are the minds behind What Works for Health. And on that note, we also have Lael Grigg with us. She's one of our evidence analysts, joining us for Q&A at the end.
Hello, everyone.
And a reminder that this is just a 20-minute webinar, so get those questions in early. And finally, we have Karen Odegaard, a community coach in the Roadmaps to Health Action Center, joining us for some technical support.
Hello, everyone.
A reminder, the slides for today's webinar are in the handout section of the control panel, as is a handout on What Works for Health. So the County Health Rankings and Roadmaps program is based at the University of Wisconsin Population Health Institute and is a collaboration with the Robert Wood Johnson Foundation. Thanks to their support, we're able to bring you this webinar today. Before we dive in, here's a quick orientation to the technology we're using today for those of you who are new. The GoToWebinar attendee interface is made up of two parts. On the left, you can see the viewer window, where you'll see our screen throughout the presentation. On the right, you can see the control panel. You'll find handouts for today's sessions here, and you can also interact with us through the control panel by using the questions section. Please feel free to ask questions or share your thoughts and experiences with us via the control panel throughout the webinar today. And again, we'd love to hear some questions for you towards the end. So first, a quick overview of what we'll cover in the next 20 minutes. We'll start with a quick introduction to the idea of evidence, talk a bit about the process of choosing a strategy, and then dive into what works for health. And again, we'll leave some time for Q&A with Lael, so we hope you have some great questions. We hear the word evidence a lot, and it has different meanings to different people and groups and to the organizations that work in this field. So we wanted to step back and take a minute to ask you what you think about evidence and what it means to you. We're going to use a poll that I'll launch in just a moment that really asks you about the criteria a physician could use when deciding how to treat you. So what we want you to think about is, when a physician is treating you, what criteria do you want them to use? Intuition, what they've heard from coworkers, past experience with similar situations, results of controlled experimental studies, or what they know by critically reading the literature. So I'm going to launch the poll, and you can select as many of these answers as you'd like. All right, looks like lots of you are answering. It's a short webinar, so we're going to give you about 15 more seconds, so make sure you get your responses in there. All right, looks like about 80% of you have voted, so I'm going to close this poll now. I'll take a look at what you said. All right, I'm not sure that the poll is showing, is it? All right, so good. So it looks like, again, there's sort of a mix here, but lots of you sort of in those last three, past experience, results of controlled experimental studies, and critically reading the literature. But people also want them to think about their intuition and gut feeling and what they've heard from coworkers. So when we think about evidence, 4 and 5 are really what we're thinking about. Randomized controlled trials and robust literature are really important, but as many of you indicated, they're not the only thing that should be considered. So being aware and conscious of the various factors that are at play in decision making throughout your process can help lead to the best decisions in the end. So this slide shows the action cycle. It's something we refer to often in county health rankings and roadmaps. It's one way of showing steps towards improving community health, or what needs to be done, and who needs to be involved to make a difference. I also find it helpful grounding to help decide when it's a good time to be thinking about using evidence to select strategies. What works for health sits here in choose. To be here in choose or strategy selection, it's important to have already have a sense of your needs and resources and have focused your attention on specific problems that you think you can tackle. If you haven't yet prioritized, all problems can really seem equally important, and it can be really hard to know where to start. So we like to think that a community is in choose when you've selected priorities but not strategies. So you know what the issues are in your community that you want to address, but you aren't quite sure how yet to best intervene. Or you've been implementing strategies to address an issue, but maybe you want to do more. For example, maybe you want to move from doing programs only to thinking about policy work. If you look around the table and the people are asking these types of questions, what works for health might be a good tool for you. So let's learn a little bit more about it. In What Works for Health, we search out, summarize, and assess evidence for policies and programs that could improve health. We do this to make it easier for communities to use evidence in their decision making, to give a menu of options communities can start from. We work all across the areas that you see on the screen, and we look for strategies, again, policies, programs, and systems changes that could affect health behaviors like diet and exercise, but also more upstream factors like education, employment, housing, and transit. Our work is generally not focused on specific diseases like diabetes. Instead, we focus on the risk factors that lead to poor health outcomes like diet and exercise. So What Works for Health includes about 360 strategies to date, and we're always adding new strategies and refreshing evidence for existing strategies. We have 6 evidence ratings in What Works for Health. The idea behind rating evidence of effectiveness is to give communities an easy sense of performance and comparison. Our ratings range from scientifically supported, assigned to strategies with the strongest evidence, to evidence of ineffectiveness, assigned to strategies that have been shown to be ineffective or cause harm. Strategies rated scientifically supported are most likely to be effective, so a home run, so to speak, when they are a good fit, and we'll talk about that a bit later. And strategies rated some evidence are also likely to be effective. Strategies with ratings in the middle of the slide, expert opinion and the insufficient evidence, have less certain evidence, and we have more to learn about them. Often we need stronger studies. And finally, strategies rated mixed and evidence of ineffectiveness have negative effects, or have had negative effects in some or many instances, and should be selected with caution or not at all. To assign these ratings, we start by defining a topic and conducting a search. We search peer-reviewed literature and gray literature. We also look at the work of reputable rating organizations like the Community Guide. We look first for systematic reviews here at the top of the pyramid, and when we don't find those, we move further down the pyramid to help give a sense of likely effects. After our literature review, we look closely at the full body of evidence to assign a rating. We consider how many studies we find, how strong they are, and how well they are conducted. So let's take a look at what this looks like. You can find What Works for Health from the County Health Rankings and Roadmaps homepage. You'll see it's located under the Roadmaps to Health tab across that orange bar at the top. It also sits in the Choose Guide. If you click into What Works for Health, it brings you to the landing page where you can learn more about how we do our work and recent updates. You can also view a short tutorial. There's a video that's about 4 minutes long that will show you how to navigate the site better, and search for strategy using the keyword search or by clicking on a health factor. So if we clicked into a health factor and then on a strategy, here's an example of what you'd find. Please don't try to read the small text there. This is just to show you what an entry looks like. You'll see the thermometer rating on the left. Below that, the health factors that a strategy can affect, so in this case, diet and exercise and education, and the decision makers who can implement the strategy. On the right, you'll see a description or what the intervention is. For the researchers on the call, this is an indication of our scope. You'll see the rated outcomes. These are the outcomes we are thinking of when we assign the rating. And then you'll see other potential beneficial outcomes. These are other outcomes that emerged in the literature search. You also see a picture on this page, a picture of a young girl on the left. This is a link to a community and action spotlight. You'll find these in several strategies on what works for health, and they tell about one community's experience in implementing the strategy. So this one tells the story of Toledo's experience in launching a universal school breakfast program. If we scroll down the screen, we'll find evidence of effectiveness. This is the real meat of the entry. It describes the outcomes the strategy has been shown to affect, along with effects for specific populations, and when available in literature, what makes a strategy well implemented and the cost. You'll see we also include the likely impact on disparities, examples of implementation where they're available, as well as implementation resources when available. So now you have a sense of what goes into our work. We want to give you a sense of how communities use this. So communities use what works for health in a variety of ways. Some things that we hear when we are talking with them is that they use it as an introduction to get a sense of what strategies they might want to consider to address a particular problem. Other communities are using what works for health to inventory their current approaches, to identify what has been shown to work and what hasn't, what to continue, and where they might consider readjusting based on that evidence. And finally, to take a step beyond the general learning and really use what works for health to help narrow down and to the best strategies for their community. However you're using this info, we encourage an approach that we refer to as evidence plus. So we believe that evidence is important, but not the only consideration. We need to think about what works based on evidence and what can work in our own communities. So we encourage the consideration of the evidence fit. How strong is the evidence, and how well has the strategy been shown to address an outcome that's of interest to you? Community fit. So how well would a strategy work in your community? And when we think about that, we think about political will, buy-in. Does it fit with community values? How would it affect those with the worst health outcomes, or that have the worst opportunity for good health? And could it help to close gaps in your community? So again, not just to think about what works, but what works for your community specifically. So County Health Rankings and Roadmaps has some tools to help you get started. Strategy-specific information for most strategies and what works for health is a starting point. There are also some tools that we have links to. So the first two are actually in the Choose Effective Policies and Programs part of the Action Center. The first is the Policy Choice Advocacy Tool. This is a step-by-step process to help groups select the policy or systems change that will have the greatest likelihood of successful adoption in their communities. The Intervention Planning Matrix is a worksheet designed to help you consider strategies that could be utilized to address the identified health issue at the individual, organization, or institution level and at community level. And finally, the Evidence in Action, a guide to selecting effective prevention strategies, helps you to find existing evidence, compile and review the evidence, set criteria for prioritizing strategies, and then selecting the strategy. So it was a lot of information in a short period of time. Some key takeaways for you to think about. The fact that evidence means different things to different people. That evidence is really an important part of decision making, but it's not the only part. And so really thinking about what else you need to think about, the Choose Guide can be very helpful there. And that What Works for Health provides information about what works, what doesn't, and how to get started. So it's a really nice starting point as a resource. So now I'm going to turn things over to Karen and Lael for some questions.
Great, thanks, Kate. Lael, we have a great question to start off with here from Megan, who is wondering about their community is working specifically on mental health issues, thinking about trauma and adverse childhood experiences a little bit more specifically, and wondering how they might find strategies related to those areas in What Works for Health. Can you talk a little bit about that?
Wonderful, of course. Thanks for the great question. So anytime you're working in an area that's not a specific health factor or focus area in what works for health, it's really an opportunity for a little more exploring to try to find the right strategy for your community. Mental health and trauma-informed care, these areas can be very challenging. They are very cross-cutting issues, and taking action in a lot of different health factors can have effects here, especially for things like mental health. So if you start with a keyword search, at least for mental health in What Works for Health, there are 75 strategies that would be returned. The challenge in choosing a strategy or strategies is figuring out what makes sense to implement in your community. So what you want to be able to do is narrow the list. And one way you can do that is by identifying a broader health factor or factor that your community is best positioned to take action in. You might already be working in access to or quality of care more broadly, or sort of in family and social support areas. If so, you can filter the results of your keyword search by that health factor, and that would help you identify a list that might be more relevant to you and your community. Another thing that's important to keep in mind is as you look at individual strategies, you can always check to see how directly the strategy is relating to your issue. So again, taking the mental health example, if improved mental health is a rated expected beneficial outcome, that tells you that this is an outcome that we are thinking about as we're assigning our rating for the strategy. So the listing is then really reflecting a strategy that's focused on improving mental health. There are other outcomes that pop up during our literature search, as Kate mentioned, that we list as unrated expected beneficial outcomes, and that definitely reflects a different level of focus for the strategy. And sometimes when you get these long lists as you do keyword searches, you'll find that really it's just referenced not as an expected beneficial outcome at all. It may simply be a side mention in the write-up and not really the focus of the strategy. So you want to give some care in selecting the strategy to make sure that you're finding one that's actually focusing on the issue you're dealing with. In general, if you find strategies with stronger ratings, something that's scientifically supported, or some evidence that also lists something like improved mental health as a rated expected beneficial outcome, you know that those are the strategies that are most likely to affect and improve mental health in your community. So they might be a better fit for you to work with.
Great, thank you so much, Lael. We also have a question about working in rural communities. Are there any strategies, specific strategies that really work best in rural communities, and how might those folks working in rural communities find those strategies?
Absolutely. This is a big question, one that has been the focus of a report that we are actually in the process of publishing. It's called What Works? Strategies to Improve Rural Health, and it is coming out soon. So everyone please keep an eye out at the end of the summer for that. In What Works for Health, there are many strategies that focus specifically on rural areas. For example, rural transportation systems or rural training and medical education. There are also strategies that focus on urban areas, and there are many strategies that can actually be adapted to work in both areas. One example that's kind of fun is in diet and exercise. In that health factor, walking school buses comes up, and most people immediately think that walking school buses is a strategy that can only be used in an urban or high-density area. But there are adaptations that can be made. Rural communities can establish remote points for school buses, where children could join a walking school bus, allowing the kids to take the bus for a portion of their route and then walk the rest of the way to school. So there may be strategies that you come across as you look through What Works for Health that don't immediately appear to work in rural areas, but with a little bit of a careful read, you might find that they actually work well in your community. As you're looking at strategies, you can also check the strategies implementation resources section that Kate showed as you scroll farther down on the page, and see if there's information about rural communities that might be using that strategy. One resource we've used in What Works for Health is the Rural Childhood Obesity Prevention Toolkit. That's from Leadership for Healthy Communities, and it has some great ideas for implementing strategies particularly if you're working in childhood obesity prevention. But it's also an example of how some strategies that don't immediately appear to be appropriate for rural areas can be quite beneficial. So you can always, as I mentioned before, start doing the keyword search. If you do one for rural, you would get a huge list. I'm pretty sure it's over 100 strategies. But as you explore and filter that list, you may find things that really work for you. And the key, as always, is really figuring out what area you want to focus on in your community to help you find the strategy that you're best positioned to take action on.
Super, thank you so much, Lael. We have one more, we're going to squeeze in one more question here quick before we wrap up. And that's, I know, one that our evidence team gets a lot, and that's just, can you talk a little bit about how What Works for Health compares to the community prevention guide that from the CDC that many of our public health colleagues are going to be familiar with? Can you just talk a little bit about the relationship there?
Sure, of course. We're excited about that relationship, actually. We've worked with them. They are using our work as a resource for some of theirs, as well as work from other groups around. So we are not the only one who is a source for the CDC on that page. But we're really excited about the Health Navigators page, trying to get people driven to our site, driven to the work we do. We think of it as a way to get some more publicity for all of these great strategies that are out there. And it's really exciting to see more people getting a chance to view what we're working on. As far as the relationship goes, we talked to them and we've definitely looked at some of our strategies. We've added some new strategies to try to help fill out the areas that they were interested in focusing on. So there's some things we added to What Works for Health after some research to make sure that we were covering all of the areas and issues that were of interest to the CDC for that.
All right, thank you so much.
Are you looking for more information, or is that good?
No, I think that's great. So thanks. I know we're a little bit over on time, folks, so thanks for sticking with us, but we really wanted to take advantage of having our What Works for Health expert on the phone with us to answer some questions. So thank you again for joining the short webinar today. We hope you have a better understanding of What Works for Health and how you can use it. As a reminder, if you have specific questions about how to navigate the site or other parts of the County Health Rankings and Roadmaps website, or specific questions about how strategies to implement in your community, please use the Get Help button on the website to connect with someone on our team. And a final thanks to our What Works for Health team, in particular Allison and Lael, for helping us today, but to the whole team really for their hard work that they put into developing this fantastic resource. We hope you find it useful. And thanks again, and we hope to see you on future webinars.